Hello everyone. This was given as quiz through Google Form. Through many participants, I would congratulate Dr. Rohit Malik, who is consultant in Mumbai, and Dr. Lakshmi Prashanti, who is consultant in Chennai, for their findings and the probable diagnosis. This is about a 68-year-old lady with a painless, partially mobile, large lump bulging through the central portion of the left breast, which is present for the past 3 years. Recently, it is increasing in size for the past few months with some skin changes, and still there is no pain or tenderness. Last year, she underwent mammogram with ultrasound and underwent FNAC too, and she was asked her not to be worried about this lesion. Now she underwent ultrasound now, and the images are given. What are the findings and how will you report with your suggestions? If you want more time to assess, pause the video and go back to see all the given images. I'm going to give the findings and the follow-up. Are you ready? Let's go. There is a partially eccentric multiloculated multicystic mass lesion in the sub and periareolar region measuring 70 mm in transverse axis and 55 mm in anteroposterior axis with few incomplete compartments. It is wider than deep lesion and each compartment of the lesion looks homogeneous, but the compartments showing different echo pattern as you see the images with poorly defined walls and septations in between them. And one of the compartments shows mobile internal echoes which is sharing with another compartment. On Doppler, there is no vascularity within or around it. There is good posterior acoustic enhancement. There is no nodularity or calcification in the thin walls. No fat standing is noted around the mass lesion. At this imaging era, this always has to be reported with BIRADS category. This BIRADS category expansion is breast imaging reporting and data system. And there are separate lexicons for mammogram or breast ultrasound or breast MRI for the BIRADS category. In routine practice, combination of mammogram and ultrasound is the best, which is perfect in more than 90% of the times. Some pitfalls are there through BIRADS pattern. And always think about the difficulties, and that's why to be correlated with the history and the previous imaging features. Three things are for the first one is there is no correlation. No correlation is discussed in the BIRADS according to the age of the patient. That's one of the important things. The second one is BIRADS is not handling about the difficulties in the too small or too large breast parenchymal lesions, which is sometimes difficult in any of the imaging studies. The breast becomes too small or too large. Lastly, there are many benign lesions which could be easily categorized as BIRADS 5 category by the imaging findings with false positive diagnosis. And on the other way, few malignant lesions could be easily categorized as BIRADS 3 or 4A category or sometimes even as BIRADS 2 category, which gives false negative diagnosis. Please go through the images about the age of the patient and the increasing malignant risk in general, even though it is varied between the countries and the ethnicity or community of the patients, or the patient has other risk factors. Now you can go through the false positive or false negative diagnosis. I am giving the list of many benign lesions which could be easily categorized as BIRADS 5 category, which give false positive diagnosis. On imaging, classified as different types of mastitis, Flo's tumor, or diabetic mastopathic changes and fat necrosis, they all might be reported as BIRADS 4C or 5 category lesions. Remember that. And also I am giving the few malignant lesions which could be easily categorized as BIRADS 3 or 4A category or sometimes even as BIRADS 2 category benign lesions, which gives false negative diagnosis. And these are all like the first one is lobular carcinoma, which could be in situ or invasive lobular carcinoma, or medullary carcinoma, or mucinous carcinoma, which is also called as colloid carcinoma, and lastly papillary carcinoma of breast, and rarely lymphoma might be presented as BIRADS 3-4 category. With all these backgrounds, we will reanalyze through the given images, our images, and with their age being 69 years. And you can see the images due to the lobulations and septations. It doesn't fit in BIRADS 2 category or also BIRADS 3 category. and so the lesion should be categorized as BIRATS 4. And due to the age of the patient and the recently increasing size of the lesion, this has to be categorized as BIRATS 4C by the ultrasound lexicons. In this patient, the mammogram was not done and the patient directly went for excision biopsy. And during surgery, just after incision, the mass just spelled out in toto and that was sent for histopathological analysis. Now, what do you think? Few of us in this quiz have given the diagnosis of benign category, and even I also reported, even though reported as BIRATS 4 category lesions, I also reported this as BIRATS 3-4A category lesion with the probable diagnosis of epidermoid inclusion cyst, and even some of the consultants have given this as the diagnosis. But histopathologically, this was reported as papillary carcinoma of the breast. So in conclusion, whenever we are going to report BIRATS category lesions, think about the false positive and false negative diagnosis as already described earlier. So I'll repeat again. Benign lesions like Phyllo's tumor, fat necrosis or radial scar, or mastopathic changes in chronically uncontrolled diabetes, and lastly mastitis due to autoimmune and granulomatous reaction and some atypical mastitis might be reported as BIRATS 4C5 category lesion with mammo and ultrasound. Similar way, few malignant lesions like lobular carcinoma or medullary carcinoma or mucinous carcinoma, which is also called as colloid carcinoma, and lastly our case papillary carcinoma and rarely lymphoma might be reported as BIRATS 3/4A category. So don't forget these facts while reporting such difficult presentations. Thank you very much for listening, and please share this with your colleagues and your subordinates. Take care and bye bye.